want to ask you a question. Like, have you ever wondered, like, when we eat food and you get diplopia or food poisoning or various kind of symptoms? So, what are the suspects of this disease?
It's due to the toxins present, secreted by the bacteria.
Yeah. So one of the bacteria that causes this disease is called Clostridium. So this is the transmission of bacteria. Gram-positive bacteria specifically. So there are three types of bacteria in gram-positive bacteria. We have bacilli, cocci, and the branching filaments. Now the topic of interest in our case is the bacilli anaerobic, and that is also the Clostridium. So what do we mean by anaerobic? Anaerobic means without oxygen it can survive. Okay. And bacilli means it is rod shaped. Okay. So in this discussion, we will talk about the general features, transmission, pathogenesis, diseases in humans, diagnosis, treatment, and prevention and control. So first of all, we will discuss about features. So what are the features of this Clostridium botulism? So it is a gram-positive rod-like bacteria. It is subterminal endospore. It is non-capsulated, like it doesn't have capsule, so it can be easily phagocytosed by immune cells. And it is obligate anaerobe. Now, what do you mean by obligate anaerobe? So obligate anaerobe is basically it is like it can survive in both aerobic as well as anaerobic conditions. Like if there is no presence of oxygen, then it can survive in anaerobic conditions. So morphology, it is able to produce the neurotoxins during sporulation, which can only happen in anaerobic environment. Like this is a condition for the bacteria to produce the neurotoxins. And it is lipase negative microorganism that grows between pH 4.8 to 7, and it can't use lactose as a primary carbon source. It can only use glucose as a primary carbon source. And the spores of organism are highly resistant to heat, which standing up to 100 degrees for several hours. Then the transmission of this bacteria, so it can be transmitted by inhalation, and by the food contamination. Then pathogenesis, the incubation period, it is a period during which an organism can infect our body. So this is called the incubation period. And for foodborne, it is about 6 hours to 8 days. For wound, it is about 4 to 14 days. And for inhalation, it is about 24 to 36 hours. And toxins enter the blood via the mucosal lining or wound. Like when our epithelium is disrupted due to some mechanical injury. So it causes the transmission of this bacteria. And it binds to peripheral cholinergic nerves. Cholinergic means it secretes acetylcholine, neurotransmitter. And this acetylcholine is responsible for the production of action potential, and this action potential is very important for the muscle contraction. So this bacteria, it inhibits this secretion of acetylcholine, so that's it inhibits and it prevents muscle contraction. So actually this is not very complicated case, but it might become complicated when it might infect the respiratory muscles, like so it causes symmetrical descending paralysis. Symmetrical descending, like from up to down, descending paralysis, and beginning with cranial nerves and progressing downwards. Cranial nerve, then this spinal nerve, then all cervical nerves. Then I spoke about this. Can result in area obstruction of paralysis or respiratory muscles. And second complication related to prolonged ventilator support and test. So human diseases, there are three forms of human diseases: wound, foodborne, and infant. All forms are fatal and need emergency care, like and incubation period is around 26 hours. Okay. So we are talking about the foodborne botulism. So it is second most common form, first being infant, and caused by ingestion of contaminated food, and most common from home canned foods. And signs and symptoms are 12 to 26 hours after infection of this botulism toxin. It can also cause muscle weakness, diarrhea, blurred vision, vomiting, and eventually paralysis. Then wound botulism, it enters via wound, which is obvious like. So under anaerobic condition, it does not penetrate the intact skin. This is very important. Like it can't now. And it is associated with the addict of black type like
YouTube बना रहे हैं
drugs.
मालूम है कि
Now, in fact, botulism is the most common form, as I discussed earlier, and it affects babies within 1 week and 1 month, and it is caused by ingestion of contaminated food, lack of breast milk, and household dust, content. Now, clinical signs. So, we have nausea, vomiting, diarrhea, difficulty in speaking and swallowing. Why does this happen? Because the muscles they get paralyzed. So, descending weakness or paralysis, symmetrical flaccid paralysis, and respiratory muscle paralysis. Then diagnosis: toxin in suspected food. We should check whether the food is contaminated with toxin. We should also suspect the serum level, like with toxin. We should also do analysis of gastric aspirates, like vomit of that person, and culture of stools or gastric aspirate, and this takes about 7 to 8 days. In the treatment, intensive care immediately, and if this bacteria evades the respiratory muscles, and then the patient should go on ventilatory support, and and we should also give the patient botulism antitoxin, and therefore equinsols, and botulism immunoglobulin. So prevention: instead canned food for bleeding or loose packing, like we should check whether the product we are buying it should have tight packing. Then loose lids, odor, we should also smell the food before buying it, and proper home canning technique, like hygiene, time schedule, and proper processing equipment, and most important, avoid home canning or cheaply produced commercial food.
Thank you. That is